Joining us now from Boston is Jerry Vitti. He is the founder and CEO of Healthcare Financial Incorporated. And Jerry, Oklahoma now saying that they will accept Medicaid expansion. This was a contentious issue for years following the passage of Obamacare. How important was this?
Oh, it's very important. I think this is the post or COVID economy and protest vote that helped pass this thing. It was only a 50.5% victory. So I think both the COVID and especially the economy played a big part in this passage.
I'm always puzzled when it comes to Medicaid expansion as to why states are against it. I mean, it gives the population a coverage that their population wouldn't necessarily have. So why do the politics work in this case?
In this case, they work because when you go to the electorate, so this is the fifth referendum that has resulted in expansion. So from Maine to Oklahoma and everywhere in between. So the issue is it's Obamacare, and folks just don't like Obamacare. You have 50% of the electorate that is against the ACA in terms of when you mention Obamacare. But when you look at referendums, folks are in favor of healthcare. They're in favor of health equity. They're in favor of quality healthcare for themselves, their children, their neighbors, and I think they want to be protected in the age of COVID. But absent that, there's a real red state antipathy towards Obamacare.
I'm always fascinated because I wondered why, when Obamacare was passed, they didn't just say, we want you to have the same health insurance that people on Capitol Hill have or in the White House. So has this always been a branding exercise as opposed to right and wrong and what's good and bad?
That's a good question. Certainly folks, when you ask them, want better health care. However, the politics of it are so divisive that you see these red states declining to take it, and it's about freedom in their eyes. It's about taxes and cost, and it's also around. I think there's a bit of bias towards, hey, why aren't these folks working, and why don't they get employer-related coverage? And so there's some perception out there that folks don't deserve coverage in those red states.
Jerry, we're going to take a break, and when we come back, I want to talk about pre-existing conditions and your concerns going forward with states that may not have Medicaid expansion, may not have adopted Obamacare, and let's talk about that. So stay with us.
I'd love to. Thank you.